It's mutated. There is now another strain of this deadly virus making the rounds. And American colleges now testing students. Has the Center for Disease Control shared everything they know in keeping us safe? There is no such thing as a safe place when one is in the television news business. And a new book details some of the more interesting things said between two of the highest paid female anchors in history. And history tells us politicians are just like everybody else, not always telling the whole truth, and sometimes having a handout when they shouldn't be asking. I'm Ed Berliner. We never fear to ask and question everything for Friday, August 29th, 2014.
Missionary Dr. Kent Brantley thanked the many strangers who prayed for him and the medical team that cared for him.
You treated me with expertise, yet with such tenderness and compassion. For the last 3 weeks, you have been my friends and my family.
The CDC said Brantley and his colleague Nancy Wrightbowl, who also contracted Ebola in Liberia, have no trace of the virus in their blood and pose no public health risk. Wrightbowl left the hospital on Tuesday. Doctors say the two are now immune to the strain of virus responsible for the current outbreak.
I'm thrilled to be alive, to be well, and to be reunited with my family.
The World Health Organization believes they can get a handle on the current Ebola outbreak within 9 months. This as news comes out about the virus mutating and a prediction it will infect as many as 200,000 people before it begins to subside. Here at home, there are obvious questions about what we have been told by the people charged with protecting us from such biological attacks. The Center for Disease Control is controversial to begin with, but have they told us everything we need to know? And are they capable of doing what needs to be done with regard to Ebola in America? Let's welcome to MidPoint, one of the nation's foremost experts in survival medicine. His work and comments can be read at thesurvivaldoctor.com. James Hubbard joins us today. Doctor, thank you so much for being here today.
Thank you for having me.
The one thing that strikes a lot of people right off the top when it comes to Ebola are the two people that we have seen in Atlanta, Wrightbowl and Brantley. We are told now that they have no trace of the Ebola in their system, that they are now immune to it, but when they came over from Africa, we were told there was no cure, but suddenly they seem to be cured. Can you bridge the gap between what we were told and exactly where we are now?
Well, sure. Not everybody with Ebola dies, not even in Africa. I mean, there's 90%, in some areas as much as 60% to 90% mortality. So some people don't survive, don't die. Their bodies produce antibodies, just like they do against any virus. And with time and support, the body kills the virus off and it's gone. So definitely they could be cured from this.
But what about ZMapp? Because that's the one that we heard, the drug we heard so much about, that this was the experimental. Did this, in your opinion, have any great effect on treating them, or was it simply a combination of both? Where is it? And not only that, but has ZMapp actually been proven successful yet?
Well, I don't think it's been proven successful yet, and I don't know enough to say how much it helped. I suspect it helped some, but I suspect they had their antibodies or their own immune system or just themselves were able to fight this off more, because there have been some of the same medications given to some other people over there, and they've died. So it's certainly not a miracle cure. Hopefully it'll help, but time will tell. And we're really early in trying to put that out. And you know, I can understand why, but we don't know the side effects, and it really hasn't been tested in humans.
If we're talking about, again, being really early, and I've heard so many other medical professionals say that as well, the World Health Organization, $490 million, a strategic plan to contain the epidemic, and as I noted, they said it can be done within 9 months. Knowing what we know now, would you say that that's very optimistic, or is that right in line with what we should be thinking now?
Well, I think it's optimistic. But remember, we're talking about Africa, and we're not talking about it spreading to other countries on a widespread basis. But in Africa, we just don't know. First off, we don't know all about the virus, and like was said earlier, it can mutate. We don't know. Viruses mutate sometimes. Sometimes they get weaker, and so then we have unlike developed countries, there's so much over there in Africa that has to go on that's not like it here. There are the healthcare facilities. There's not enough healthcare facilities to take care of all these people. People are afraid of Ebola over there on a wide scale. They're afraid to tell people, tell the healthcare people that they have it in some cases, and so it continues to spread. So I don't think anybody really knows what's going to happen in the next few. We've had viruses before, horrible viruses that just went away with time. They mutated out, possibly away. I don't say Ebola is going to do that. It certainly can be a lot worse. We just don't know.
As a doctor, how concerned were you when you heard about the Americans coming here? Because certainly there was a tremendous amount of panic from a number of people, and a lot of folks were screaming as if the actual disease had come here and we were going to be in imminent danger of some sort of a panic and some sort of an epidemic.
Yeah, I wasn't concerned. I knew that they knew they had Ebola. They took all the precautions possible on the plane trip. As you may have seen, that everybody had on, basically what they call spacesuits, everything covered, and so the only people that I suspect, there's always a possibility that these infected people could directly give it to healthcare workers. Healthcare workers always have some risk in any type of bloodborne or other type of infectious disease. It's a risk. They take every precaution they can, but it's possible. So I wasn't too concerned about those two coming over. And like you said, the thing was that people said, Ebola's, a plane ride away, and it was in that situation. And I suspect, or pretty well, I'm sure that there will be some people that come over here that have Ebola from other countries, and they may spread it to a few people, but it's not going to spread on a wide basis over here unless it mutates to airborne.
Now, we have human safety trials for a new Ebola vaccine. GlaxoSmithKline has developed them. These trials are going to begin next week. In your opinion, has this vaccine now become a top priority for all the various pharmaceutical manufacturers?
Oh, I'm sure it has. And whether I'm sure that all the treatment for Ebola has become widely a big priority for everybody involved.
What about the CDC now? I do want to turn to that because the CDC has had a problem. They've had a number of recent anthrax cases, the anthrax incident itself, and there are people right now who just don't trust the CDC. In your opinion, as a medical professional, are they doing everything they possibly can to try and stop these diseases? And I guess the second part of that question is, are they a well-run organization in the first place?
Well, I think you can see by the news that they could do with some changes, and I think they admit that. But they're a big organization, and bureauccy of 15,000, I think, or something like that. So they're always going to be some what maybe weakest links or something, and there's always going to be this possibility that somebody's doing something that's not right. I think they're trying to do the best they can. They have a horrible situation over there in Africa trying to get that, and I don't think that everybody really knows everything that's going on over there as far as what exactly all about the virus, how many people have had it, because just think about trying to go over. I think there's 1 billion people in Africa, and just think, and all the little villages and things, and a lot of people paranoid and not wanting to report it because they're afraid of something might happen to them. There's no way to tell for sure how many people have it over there.
Is there a level of confidence from medical professionals such as yourself about the CDC, or in private, do you still doubt them?
Oh, I think overall there's a level of confidence in the CDC. I don't think they're perfect, and I think you ought to, in anything they do or say, you ought to with everything, look into it further. And they're, I'm sure, like every organization around the world, they're not telling us everything that's going on. They're telling us what they think we need to know, But overall, I think they're doing just about as good a job as any organization could at this point.
Well, we got about a minute left here, so let me ask you then again, as a medical professional, the CDC, bioterror is a word that we hear an awful lot here in America anymore, certainly with various terrorist groups around the world. How concerned are you about a bioterror coming here to America?
I'm always concerned about it. And here's what I would say about that and Ebola and everything else. Be aware and take precautions for everything. Bioterror or what, I'm sure there are viruses and other things going around every day that our body has to fight off. So keep your body and immune system built up. And also take those precautions like washing your hands really frequently and before meals, and washing them well. And you know, if you have, staying away people coughing, if you have questions, use a mask. Do things like that, and assume that anything could be in the air, because you know, who knows whether it be bioterror or the next type of Ebola or something. Sooner or later, probably something's going to hit hard here in the United States. And whether or not we predict it ahead of time is hard to know. And so I don't want people to get burned out about when they have scares about things like Ebola and then let it go and forget about it. Have your life and do what you can, but also take those precautions, and you'll be way ahead of the game.
Basic common sense, indeed. TheSurvivalDoctor.com, Dr. James Hubbard. Thank you so much for joining us today, Doctor.
Thank you for having me.
Later this hour, politicians receiving gifts. Shocker. That and so much more coming up right here on MidPoint.